Good afternoon, everyone, and welcome to another COVID-19 outbreak update here from the Rath Building. I'm Erie County Executive Mark Poloncarz, joined by our Health Commissioner, Dr. Gail Burstein, as well as Kathy Gambino from Deaf Access Services. We are here to provide the latest information that we know in regards to the outbreak of the coronavirus and COVID-19 in our community. We have some important information to share with everyone. We, of course, have been, like everyone else, keeping track of the other briefings that have been made, including by Governor Cuomo. We are thankful for our friends downstate that they seem to be at least reaching a peak, though we know it's pretty high. And we'll talk a little bit more about that with the new New York State tracker that they have by county. But I certainly want to share the latest that we have here in Erie County because we have some important new information to share. Once again, the information on the PowerPoint presentation is current only as of the data, or the time and the date of the presentation. System, and I should say the situation rapidly changes. And we got the latest numbers at about 2:25. And I was changing the presentation while sitting here before we started, so the numbers do change very frequently. As of 2 p.m. today, there were 1,234 total positive cases for all labs of Erie County residents. As of 1:45, we unfortunately have to announce that there are 9 more people who have passed. There are now 39 individuals in Erie County who have died as a result of the coronavirus. Actually had the unfortunateness of having to talk to one of our own staff members today who lost a stepbrother down in the health department. So this is touching all sorts of families. And I want people to understand that it is this serious, that people are unfortunately passing as a result of the coronavirus and COVID-19. So to each and all of the family members, we do have our deepest sympathies and condolences during this very sad time. We know that the only way to stop more deaths is to reduce the spread, to flatten the curve, to smush it, as the doctor said yesterday. And if we don't do that, there will be many more deaths. So to all that have lost a loved one, you have our deepest condolences. 263 people have recovered. That number continues to grow, so that is a good thing, a positive with regards to those who've contracted the coronavirus. There are 932 people in isolation. As of yesterday's report, where we get a report at the end of each day, which is for the day before. So as of yesterday's report, which is really for the day before, there were 203 individuals that were hospitalized. Of those, 114 were in ICU, and 108 of those had an airway assist. So as you'll see on the chart here, the actual number of individuals that were hospitalized has decreased, but the number of individuals that are requiring airway assist in ICU has increased. It's twofold because new hospital admissions continue to grow and unfortunately deaths that occurred. Doctor, would you like to talk a little bit more about that?
Sure. So as the county executive mentioned, that the total number of people admitted to the hospital with COVID-19 looks like it is declining. However, unfortunately, the total number of admissions continues to grow. The people who are being discharged and also the total number of deaths just from yesterday made it look like the number in the in the hospital are declining. But that's just an artifact, and really we're seeing an increasing number of very sick people being admitted to our hospitals. You can see the numbers that we're very worried about are the number of people in the ICU and the number of people on ventilatory support. I mean, that's about half of the hospital's mission. So the people coming in are very, very sick and require intensive care. We don't really see this with any other type of disease. So these are very, very ill individuals once they get into the hospital.
And these are not the only individuals who may require a ventilator. There's other individuals due to illnesses and other diseases, including lung cancers, respiratory issues that may require a ventilator. So the more we can keep the number of ICU and airway assist numbers down, the better it's going to be for the entire community. The online case map is continuing to be updated on a daily basis, multiple times daily. It sometimes will lag from the information that we describe So I do expect that the numbers, because we just got the latest numbers with regards to cases of 1,234, I do expect that to take a little bit of time to come up, and we'll check it out at the end of the presentation when we look at the map. The zip code feature is live. Sometimes the zip code can be a little deceiving. I'll give you an example. There were people who were questioning about Lackawanna, why its numbers were slightly off. Well, the 14218 zip code does not include all of Lackawanna, but it also includes parts of Hamburg, because the 14219 zip code also includes part of Lackawanna and Blaisdell, but not much of Hamburg. So sometimes there can be discrepancies if you look at a town or a small city and compare it to its zip code, because the zip code might not actually be the entire community, and it also might include a little bit more, like 14215 in the city of Buffalo, which is the largest zip code based on cases. It has one of the highest populations among all zip codes in the city of Buffalo, plus it also includes population in the town of Cheektowaga, so that can be a little off if you're trying to do a comparison based on where they reside as a result of their town or city. But the zip code feature is live. There was an error. We described it yesterday. We realized that there was because of incorrect coding, cases that were in Orchard Park, primarily associated with the outbreak at Father Baker Manor, were improperly coded into the village of Kenmore. The village of Kenmore is 14217. The town of Orchard Park, including the village of Orchard Park and where Father Baker Manor is 14127. So there was a coding error in which Kenmore came up much higher than it actually was. That was fixed, and of course, as a result of that, Orchard Park jumped up. New York State Department of Health has a COVID-19 tracker now based on county. You can find that online at www.ny.gov/COVID-19 tracker, and it'll do it by counties. We'll look at that again a little later, but you can see Erie County is one of the darker colors on the screen because it has over 1,000 cases as of this moment, but we do not compare to our friends downstate that have tens of thousands. On the response, agriculture, this is something that's been brought to our attention. I was on a conference call yesterday also with Senator Chuck Schumer, in which one of our representatives from the agricultural industry in New York State was talking about how they're dumping milk due to the fact that milk prices, and there's limitations on what are being done with regards to milk, even though milk and dairy and agriculture are considered an essential business. So there should really be no limits on dairy because dairy is available, and unfortunately farmers are having to dump their milk because they can't sell enough due to the way the demand is right now. So what we want to remind everybody, including grocers, that there should be no restrictions on dairy. Farmers have an excess supply of milk, so there should be no reason to restrict milk at this point, milk sales. We want people to buy the milk that they need, and there are families, of course, that consume a lot of milk on a weekly basis, so there should be no reason to restrict milk because there's, in some ways, an excess capacity to the point that dairy farmers are having to dump the milk that they have because of the issues associated with the excess amount. So grocers, sell all the milk you can. There's no reason to limit that in the purchase of milk or other dairy products. Nurseries and greenhouses. Nurseries and greenhouses are considered essential if they also sell food-related plants, which we know a lot of our friends, especially in the Eden Valley Co-op in those areas, they have nurseries that sell only food-related plants. They can also sell flowers and plants direct from their farm and at farmers markets as long as they sell food and vegetable plants. We want to support our local agricultural community. A lot of people think this is the time when they start planting in the ground, and that is correct, but it's also the time in which they'll be harvesting what they have in their greenhouses, which is often a lot. So don't be bashful if you see and you drive by a stand, even though we want limitation on what you can and traveling in the community, but if you do, take a look and support our local agricultural community. We seem to be having a technical issue here. Is everything okay?
I think that the telephone there is not connected.
Okay. I think the telephone is not connected. It shows that it's connected.
Okay.
You can check it if you need to. It seems it's still going.
Yeah, you're on.
So, the wonders of modern technology. Sometimes it works, sometimes it doesn't. but we're having a little issue. Now, stay at home. Doctor, you want to talk about this?
Sure. So what we're really pleading to Erie County residents to stay at home. Really, we only want you to go outdoors for essential shopping or some type of essential errands, like to pick up pharmaceuticals, although we know all the chain pharmacies and many of the independent pharmacies are offering free home delivery. So please don't go to store just for fun, just to look around as something to do. And please, if you go to the parks, please don't go in groups. It's okay to go with maybe just your family and go to a path that is not well treaded and go explore something new. But please do not congregate in large numbers. Just stay at home. Staying at home protects lives. All the effective social distancing that we've done, 2 weeks ago, we are seeing the fruits of that now with our hospital admissions flattening out. Again, we know the ICU and the ventilator support is still increasing, but it's not increasing like the numbers that we have been. So if we want to see this curve of ours, as I said, squished and lengthened out instead of peaking and going beyond our hospital capacity, we all have to be good and stay at home. And that will include with the holidays coming up, and I know that people are going to be getting together and thinking about observing the holidays of Good Friday and Easter. And traditionally, it's like great to be able to go to church and see everybody. And I know for the Jewish community, we have big seders, but we have to do things differently this year, and we have to think about how we can observe the holidays and how we can pray to God in much smaller groups, just as family units or as individual units. And with technology now, we have to be innovative and figuring out how to do it. But again, like going to a big church service or going to a big family seder could result of people dying, and that's not the point of religion. And we just have to respect the situation that we're in, and just stay at home, stay in small groups, and stay safe.
So with this being a very important week on multiple religious calendars, with Passover among our Jewish brethren, like Dr. Burstein and her family, my family, of course, with the upcoming Easter and Good Friday services that normally would be held, we want people to understand that watch it online. There are going to be services that will be offered online, including by the Catholic Church, Good Friday observances with regards to the Stations of the Cross, as well as Easter. And we know that for a lot of folks that's a tough thing to do, but as I noted yesterday, I did commend Bishop Scharfenberger in his decision to limit and close churches with regards to masses. For some people who go every day, it may have been the first time in many, many decades that they have not attended a mass. And we want you to understand that it's done to protect you. And when we all get through this, we'll be able to return back to our normal daily routine. As usual, we have lots of resources that are available. The COVID-19 call center is open from 8 a.m. to 8 p.m. daily, 858-2929. High volume often. Expect waits if you are calling at peak times of the day. It's a little better usually in the evening. Do not ask hypothetical questions. The individuals are trained to answer a lot of questions, but generally not hypotheticals. So if you have a particular question related to the health and wellness associated with COVID-19, coronavirus, call that number. If you have general information that you're looking for, out in the city of Buffalo, you can call 311. Outside the city of Buffalo, you can call 211, and they'll be able to provide that. And of course, plenty of websites. You've seen that over the days with regards to the websites that are available, including our own erie.gov/COVID-19 website. I think it's very important that people understand that we have lots of resources online for you to take advantage of, and we hope you will. With that, before we turn it over to some questions, I'm just going to get out of this presentation and go to, once again, look at the tracker. Now the tracker for New York State is by county, so you can click and it'll show you Erie County, and this of course is a little delayed. It's a lower number than we actually have because we have the latest numbers, but if you look at our friends on Long Island, which are having some serious problems right now, there's Suffolk County. They've got 14,000 cases, so they got more than 10 times as many cases as what we have here. And they're a little larger than Erie County, and same thing for Nassau. Nassau's larger than Erie. and they've got over 16,000 cases. They are larger, but they're not that much larger. They're not millions of people larger. So there are some serious concerns. And just to give you an idea, Nassau County has 16,000 cases. Manhattan, or New York County, has 11,000 cases. So it's really pretty bad on Long Island. Westchester, which was the first county to really feel the brunt of this, they're 14,000, and Westchester is almost identical, just a little bit larger than Erie County in population. But you can see they've got over 10 times as many confirmed cases. We know there's more cases that exist in Erie County. We just haven't confirmed them, but we do not believe we're anywhere near as high as what they have, because while we don't have enough tests to test everybody that we wants to get tested, the same is down there. I've talked to my counterparts down there, and they are not able to test everybody who wants to get tested. So it's not as if everybody who wanted to get tested down there got tested. That is not the case. Unfortunately, in Westchester County, they have a lot of outbreak there, but it's not to the same extent with regards to over-testing there. They've tested more. They've certainly tested more, but they have not tested everybody who wants it or would like or they think should be tested. Just part of the problem of what's happening right now in our country with the shortage of tests. So there's the state tracker, and then, of course, the county tracker. This had been updated with the deaths and total recovered, but still the confirmed cases, it was so new when we talked about it that there was 1,234 confirmed cases, and our tracker only shows 1,163. So we just want to let you know sometimes the tracker can have a delay to it. So we don't want to keep that on the screen because we don't want people to think that that is the correct number, because it isn't. And with that, we'll open it up to some questions. I hope they're still on the line. It sounds like there may have been a little issue with regards to the phones, but I think we're okay. So why don't we start? See, is anybody from AP on? Remember, you can unmute your phones now. B News, Business First. If not, we'll go to the Buffalo News with Sandy Tan and Aaron Bessiker.
Thank you. My question is, well, first, if we could, again, make the request for gender and age range information for hospitalizations and deaths for those who've been confirmed to have COVID-19. We've been seeing lots of news reports regarding the impact that COVID-19 has had on race, that there are more African Americans who are dying of this illness than other folks. I'm wondering if you guys are also breaking down that information as far as tracking deaths, and if you've noticed any pattern.
We don't have it in the presentation because we did not have the most recent ones with regards to deaths. The problem is when we get the reports in from New York through their eClear system, it does not identify race on the positives and the negatives. We generally don't find race until the deaths, and so that takes a little bit of time. There's a lag in it. I believe there were 8 African Americans who died out of 30 cases, the first 30 cases. I don't have the most recent 9. So that percentage is there were 6 in the city of Buffalo that were African American, and there were 2 outside of the city of Buffalo that were African American, and the rest were white or considered white. It may have been Latino, but they were identified as white. So we will try to update that. The problem is it is a lagging number. It's a lagging indicator. We don't often get the racial information until some days later, because remember, not every death goes to our medical examiner's office. It can go straight from the hospital or a nursing home and can go to a funeral parlor. We may not get it. So, Doctor, if you want to talk a little more about it.
Right. Actually, these COVID-19 deaths are viewed as natural causes of death, so they're not suspicious. So our medical examiner is not handling them in general. Also, the data that we receive from the New York State reporting system usually does not include race, and so if we want to look at that, we have to go to each individual death and look up their demographics. So we've been able to do it as per request for now. However, we're following almost 1,000 people in isolation. Our epi unit is working very, very hard, and I can't promise that we'll be able to continue to provide these data. We are providing on a routine basis data on age and gender of people who are diagnosed and also on deaths. However, we're not going to. It will be very difficult to look in every single case because unfortunately we are going to be seeing many more deaths. And then in terms of the hospital data, those are actually not our data. Those are census data that the New York State Health Department collects. During this COVID-19 crisis, the state has granted us access to view these data. That's why we're able to share it with you. However, it is not our data with our patients. There are quite a number of patients that are not Erie County residents that included in those hospital census. So we do not have the ability to share any demographic information on the hospital census data.
So then, can you provide at least the death information broken out by age range and gender?
Well, we will. We've provided the age, range, and gender in the past. We will try to provide it by race as best as we can. That will often take longer. When we get the case in, we know exactly who the gender is. And when I'm talking about the case, I'm also talking about it as a positive. We know the gender and we know the birth date, so it's pretty easy to figure that out. The biggest problem is the staffing issues right now, and the individuals who have access and can put this data together. As you can imagine, we have to make certain that we're very accurate in this, that we do not want to give out wrong data. So there's only a number of individuals that are actually working on that because they have to have access and see the case file and the individual's name, so there are limitations on that. But we will do that as best as we can. As I said, the latest data I had, which was from earlier today, which was, of course, missing now 9 deaths. So it's doing a disservice to 9 individuals who have passed, and we don't want to ever make it seem like that we're discounting individuals who passed. But there were, of the 30 previous deaths, 8 of them were African American, and the other ones were identified as being white. Erin, do you have a question?
Yeah, a little bit of a follow-up to that. The state has said this morning that they've been reaching out to local morgues to get that demographic information, and then they're going to be releasing all of that information by the end of the week. Is that going to be incorporated into the county map once the state does release all that information to all of the counties?
Well, I heard it said earlier by Melissa DeRosa. I think they're going to have some problems because our morgue does not get all this data. And most counties don't have morgues. They have coroners that often are funeral home parlor directors, so that data may not be as accurate as you'd like it. I don't know what the state's planning on doing. I know they've had a lot of requests for it. People have said, why aren't you putting more racial data out with regards to the positive cases? And the answer is because we don't get that information from the state. If somehow the state's able to change the system and get that data, it makes it a lot easier. But we're relying on the state data. Because what ends up happening is you get a report, and it's basically an electronic report that's printed out on a piece of paper that identifies the person, their gender, their age, their town of residence, their address, and that's it. I mean, you don't know their race, you don't know their religion, it's not identified on there, so it's not data that we have access to.
I mean, to look at the race, we would have to go to each individual case on HealthyLink and try to find that individual and determine if they have race listed in their HealthyLink account. So again, it's a very time-consuming task, and race is usually data that isn't is usually incomplete in the New York State surveillance data that we receive.
Aaron Besecker from the
Yes.
Buffalo News, do you have a question? And I have a terrible
Thanks,
itch
Mark.
on my nose, so if I'm itching my nose, it's because I have a terrible itch. Go ahead.
I just wanted to follow up on something you mentioned earlier. Initially, when you were going through the stats about the hospitalizations going down, but the people that are showing up seem to be more serious, I believe, in terms of just being in the ICU or needing airway assist. I mean, how do you explain that? Is it just is this something about what kinds of is it hitting harder now? I know you talked about the curve flattening, but what do you make of the people going to the hospital now being more seriously ill?
Well, we believe that while we flattened the curve, that doesn't mean that we've stopped individuals from contracting it. And there are more individuals who've come in contact with it, more people who are at greater risk because of their underlying health conditions. And therefore, while the hospitalizations have not jumped up in the last couple of days, they did grow pretty substantially the few days before then. And the hospitalization number for that one day may be an anomaly. Because we did see admissions the report that we had, there were greater admissions for that day than there were discharges. And we know there were deaths. We also saw the increase in the ICU. So it may have just been an anomaly where we had the one day where the total hospitalizations went down. We'll know more about it over tomorrow and the day after that when we start getting more data. But we are going under the assumption that our hospitalization is going to ramp up in the next week substantially and continue to grow through the remainder of this month. Doctor?
Yeah, thanks, Mark. That was a great explanation. I mean, remember, yesterday's data were just, I think, a blip. It was just, they just happened, unfortunately, to have a larger number of deaths and discharges than they did admissions. However, the number of admissions were greater yesterday than they were before. So we're continuing to see more people requiring hospital admissions. And of those that are admitted to the hospital, we're seeing become sicker and sicker. And we know that, and that's really reflective of the overall prevalence of COVID-19 in our community. We know that, unfortunately, 15 to 20% of people who develop COVID-19 are going to become very, very ill and require hospitalizations and require admission to the intensive care unit and unfortunately die. And so, we're starting to see those numbers increase because we know, even though we're not doing the testing of everybody in the population because we can't, we're seeing, that's why we're closely following the hospital data, because the denominator of that, we're seeing this among everybody in the community, not just the people that we hospitalize. So we know that with our intensive care unit numbers going up and our ventilator support units going up, we know that there's a higher number of overall sick people with COVID-19, which means there's a higher number of overall people with COVID-19 in our community. So that's just a trend that we should unfortunately continue to expect.
Steve Brown from WGRZ.
Good afternoon. I spoke with April Baskin earlier today, and she says that she has reached out to you and the health department in regards to getting a testing site set up in her district, particularly in zip code 14215, where it has the largest number of cases. I don't know if that's currently achievable, so just wondering what the status was with that request. Also, she mentioned that if testing capabilities on the Erie County level are become expanded at some point, the next category to be tested, to be included in the priority group, would be chronic illness. I was wondering if you could confirm that as well.
I can't confirm that. I don't know if that was the chairwoman just talking that she thought it should be. Doctor, can you talk? Steve, of the people that we need to test that are meeting our criteria, our healthcare workers and other essential employees, the testing that is available to them is at their workplace many times if they work in the hospital, or there are several sites throughout the county, in the city and in the suburbs, that are available for those essential employee that meet the criteria to be tested, to get tested. So right now, the people that we are able to test, because we will do something with those results, do have easy access to testing and are getting testing. With our criteria are expanding, again, it's for individuals that, we're expanding the categories of essential employees, and we're also looking at people that receiving therapy in centers like infusion therapy or dialysis therapy, that they need to be moved to a different location
if they are COVID-19, not to infect the other people getting that therapy. So that's really the only category of people with chronic disease that we're considering expanding to right now, given our current resources, because we will do something with that information. Just to clarify that again. We have limited resources for testing, and so we are only testing individuals that we can do something with a positive test result with that information. Unfortunately, there is no vaccine to prevent this disease. There is no treatment for this disease, so we can't test people to see if they're eligible for treatment because there is no treatment. So again, we think we are using our very precious testing resources widely, and those that need to get tested do have easy access.
And
Again,
your first point, I think we've had requests from public officials and others to set up testing sites all across Erie County and say, I want you to test my subgroup. And the answer to that is we do not have the capability to do walk-in testing sites for the general public at this point. And if we do, we would certainly not limit it to any one group of individuals. If we have the capability of testing for walk-in sites, then it would be available for everyone, and right now we do not have that.
Got it, thank you.
Okay, Kelsey Anderson from WIVB.
Hi, good afternoon. I'm just wondering why you guys can't release details about Western New York nursing homes, like how many positive cases are coming out of nursing homes, and then added on to that, do you believe family members of people living in nursing homes have a right to know whether or not a resident of that nursing home has coronavirus?
Nursing homes, there's certain regulations associated with them, and part of the problem is often we'll get descriptions of individuals and they'll put their regular address down. We don't even know that they're in the nursing home. We've dealt with that a number of times. So sometimes the numbers with regards to nursing homes aren't accurate until we actually have a guarantee that the address and the location for the individual is where they say they are. We've had a number of situations where we've had individuals identified in particular towns because they're listing their home address when in fact they may be in a nursing home. So we don't always get the most accurate data about somebody who may be in a nursing home. And so that's a problem. New York State is the primary regulator in nursing homes. We've certainly done some additional regulations with regards to Ruthie's Law. And that's a whole different subject matter. But it's the New York State Department of Health that is working right now with Catholic Health Systems with regards to Father Baker Manor. I think the public thinks that we're hiding information or we're keeping data from them, but that's not the case. We are providing the most upfront, open data that we can, and there are sometimes we just don't have the data. So to go out there and say, you know that there's a certain outbreak in a nursing home, that may not be the case, because if you look at it, you might say, well, there's only one or two names that seem to be associated with that nursing home because that's all we have based on the address. We don't know otherwise, because remember, what we get from New York State is a report that sort of, and when you print it out, it's just a sheet of paper, and it identifies the name, their address, which could be a nursing home address or it could be their home address.
It doesn't always have the address, actually.
Well, that's true. Their gender, their birth date, and positive or negative. And there's really nothing else on it. It's pretty much a plain piece of paper. So there's not as much information that I think is being provided to us that the public sometimes thinks is. Madison Carter, WKBW. Still on, Madison?
I know I'm on here. I know we're talking about the 14215 area, and you said that you think a lot of those cases have to do with people being healthcare workers.
And law enforcement and first responders, firefighter, but not all. They're not all. We're not going to say they all.
And patients.
And patients, yes. Patients.
And I think there might be some confusion with people thinking that you're talking about doctors and nurses when really these are low-wage first responders. And I was walking around the neighborhood today talking with people, and I talked to more than a dozen people. Not a single one of them knew that they were living in the area that has the highest amount of cases. So when you were saying yesterday how the county's not necessarily taking a separate approach with that that particular zip code or the higher hit areas, is there anything the county can do in terms of education or outreach or just getting people resources and information that live over there?
Well, that's what you guys do. That's why we share the information. That's why we did not have the zip code map
But
for
we're
the.
not getting information is the problem. Like, we're
Well,
not
you
getting
got the information in the last couple days. We didn't. If we had done, well, you weren't on the call yesterday, correct? I don't think you were.
Correct.
Yeah, if you were on the call yesterday, you would have heard me say that if we had this conversation a week to 10 days ago, there would have been almost no concern about 14215 because we almost had no cases from 14215. Almost all the cases that we'd seen during the first 2 weeks of the outbreak in the city of Buffalo were North Buffalo and the Delaware district. And we've seen a big jump in the last week with regards to 14215. Just like the first week and 2 weeks was almost most of the cases you saw, it was even between the town of Amherst and the city of Buffalo, and that has changed. So I don't want it to think that we had data that showed, there was an outbreak in the 14215 zip code, which is Buffalo and Cheektowaga. We didn't have that data. And that's why we're trying to rely on media to get that information out.
The question is, you're saying that the county is not taking a unique approach to that area, which has a great deal of people living in poverty, a high population of black people living in this area that don't have access to a lot of information. So is that going to continue to be the approach? You're not going to take any special approaches to places that are being harder hit?
Well, what are you trying to say, Madison? Are you saying that we're ignoring people because of where they live? We just try to get accurate. We're just trying to get accurate information out.
I'm asking whether there's going to be any additional resources given to these communities that don't have the resources to begin with.
We have limited resources. We have not received a dollar yet from the federal government, and right now we are have a tremendous amount of revenues that are coming in. So if there's an assumption that we're going to be able to spend more in any one location, that probably isn't going to happen at this point until we at least have additional resources coming in from the federal government, which we allegedly are going to get, but we've been told we probably won't get them until 30 days after their letter was received from us, which was sent out last week. And even then, there's limitations on what we can do with those funds. We're trying to get accurate information out to the entire public about the coronavirus, which is everywhere. It's not just in one section of Erie County. It's everywhere, including yesterday. We had our first case in the town of Collins in the village of Gowanda. So now every town in Erie County has at least one case. The 14215 not area code, zip code is a concern, and that's why we brought it out, so that there would be knowledge about why there seems to be an increase. We can identify because we've tested first responders, we've tested police officers, and we're getting tests from healthcare providers showing that some of these are their employees, but not all of them are. Some of them are patients. We're trying to get accurate information out to the public and to let everyone know that everyone matters, everyone counts, and we're going to try to help out as best as we can. Our fear with the growth in cases is that we're going to have thousands and thousands of cases across the community, and it will be tough to address any one case in particular, just like it would be difficult to address any one area in particular, unless we saw that there was a substantial amount more of outbreak. And then there's only one thing to do. I mean, here's the thing. It comes down to this. There is no magic potion you can take that prevents you from getting the coronavirus and COVID-19, other than locking yourself inside your house. And what we're hearing is there's a lot of reports of people ignoring it and having parties and just going out there and treating it like it's a normal day. And that's how people are getting sick. I had a message from someone saying, I poo-pooed the coronavirus, thought it was stupid, it was killing my business, and then I found out my cousin died. My cousin who was healthier than I am. And now that person is feeling terrible because they wondered, well, I wonder how my cousin got it. And I think it's important for all of us to understand that there are ways to protect ourselves, and that's to prevent the further spread of it and the contraction of it by staying inside. Right, doctor?
Exactly. And also I just want to point out to remember the numbers that we're giving you are the total number of positives. it's not and that's a reflection of the total number tested. And so, we don't have the proportion of tests in that zip code that are positive. So does 100 tests mean that out of 200 people tested or 1,000 people tested? I mean, that means something different. It's also not, a rate of per population. So this is just a total number of the tests that we've done. These number of people have been positive. So it doesn't mean that there's a huge outbreak in that area. It just means that we obviously must have done a lot of tests in that area, and we're seeing quite a number of positives. We know that about 25% of the tests that we do in general turn out to be positive. And again, those are the people that are symptomatic that we end up testing. We also know that there are a lot of people that don't have any symptoms at all and feel fine, or just might have some mild respiratory symptoms, or in some medical literature it says that sometimes people can start out with some diarrhea, some GI symptoms. Again, most of the people that have COVID-19 we have not identified. So just because we haven't counted a number in the map doesn't mean that someone is not infected in that area. We have to assume that it's everywhere, and we have to assume that anytime that we go out, we could be exposing ourselves and bringing it home and exposing other people that are very vulnerable. And that's why we're asking people to stay at home.
Yeah, we're just trying to ensure that we get an accurate information out with regards to as we know it. That's not everything. When we say confirmed cases, we mean those are the cases that have been confirmed positive, but we know there's probably thousands and thousands of other cases out there across the community. We just haven't confirmed them yet. Is there anybody has not spoken that was called on or was not called on it?
Hi, Mike Baggerman from WBEN here.
Okay, Michael, go ahead.
Hi, Mark. Regarding homelessness in Erie County, what is the current occupancy of the Flickinger Center to help those homeless people? And the second part of this question, are people from other regions in New York State being transported here to live at the Flickinger Center on a temporary basis?
Not that I'm aware of from other regions. I don't have the exact number. Last I knew there was about 85, but that was 2 or 3 days ago, so we could get you the number. I'd have to check with our staff, but I am not aware of anybody being transported in here to live in the Flickinger Center. I've not heard that. Going back to the top then, Buffalo News, Sandra?
Yes. So we've been listening to the governor say that he is hopeful that New York, at least downstate New York, is reaching its peak and might be plateauing or might be kind of over the hill. And I'm wondering if you have been looking, taking a fresh look at modeling for this region in light of that news, if you had a better sense as to when we might be seeing our peak here.
We do have some modeling that has been performed by third parties. It's not our models that have been done by Erie County. However, in the best case scenario, we don't reach our peak. Let me backtrack. In the worst case scenario, we get our peak sooner, but we have over 10,000 hospitalizations in a terrible situation. We'd reach our peak basically at the end of this month. In a best case scenario, if we continue to follow the flattening of the curve, our peak will not come until sometime in mid-May. We still will have thousands of hospitalizations above what we potentially can handle. So we're not liking the models. And that's why people need to stay home and stop the spread of the coronavirus. And the models are based off of even Google Analytics with regards to travel and how people are moving in this community. I don't want to say they've done a better job in New York City of being locked down, but as a percentage of their population, I think more of their population is being less transient than here, in which we have some areas that are very good and others where people are just going about their business and treating it like normal. So if we cannot flatten that curve more, if we continue on the current trend, we're looking at mid-May. And I know a lot of people don't want to hear that, including we were going to set up a call with superintendents, but I don't know why schools are planning on returning. on April 20th, when the governor's already extended the stay-at-home orders basically until April 29th, we are going under the assumption that we're not going to reach our peak until the middle of May.
So even though the governor's model seems to be trending better than expected, you're not seeing there's no a corresponding shift in the models you've seen?
Well, the governor's model may be based off of full statewide numbers. And remember, we started 2 weeks to 3 weeks after New York City. So they don't know if they've reached their peak. They're seeing some plateauing of the hospitalizations, though yesterday through today was the worst death day. I mean, that's not a good sign. You want to see a plateauing in deaths and illnesses and hospitalizations, just like we have the one data day that shows hospitalizations going down, but ICU numbers going up, and also was one of our worst death days. So can we say that we're plateauing? And the answer is no. We just had one little blip, and we'll keep a track on it. But the modeling that we've seen is not showing us ending this in the next 2 or 3 weeks. Doctor, would you like to add?
Yeah, thanks, Mark. I mean, and remember the population density is highest downstate, and so that might push the model to look at more at trends towards downstate compared to upstate. We know that the state is very diverse, and that the onset of each of the different counties' epidemics has started at a different time. So we believe we're probably 2, 4, maybe 6 weeks behind New York City. So we'll have to wait to see when they peak. However, we can't say that, nobody's saying that they've peaked yet. So again, we're at a waiting game, and that buys us time. It buys us time to be vigilant with social distancing and try to keep that curve squished, and that will extend it. And then also it buys the hospitals time to try to secure more personal protective equipment and ventilators and get more hospital staff on board. So it's buying us time. I know on the in the community end, it's very frustrating because that additional time is basically spent everybody in quarantine, which isn't very fun. However, it's really a balance. Are we choosing? Is what important for us lives, or what's important for us is to go shopping and have fun? I mean, it's really an ethical question.
So modeling is just that. It's a statistical analysis based on a number of factors. Our models are the ones that we've seen are based on Western New York and the Western New York counties. It's not based on New York City. And we have looked at those models. We've shared the analysis with New York State because I think their interest, they asked for it, truthfully, because they have models that are more based off of the statewide analysis. And remember, it's a shorter drive from Buffalo to Columbus, Ohio than it is to New York City. We have more in common with people in Toledo and Detroit than we do New York City when it comes to a region. And truthfully, the delay that we received with regards to the coronavirus is very similar to a lot of the other Great Lakes communities. So I don't think it's an apples to apples comparison. When the governor's talking about reaching the peak, he's looking at overall statewide totals, which have been predominantly dominated by New York City, Long Island, and Westchester. So if you're seeing a drop in New York City, Long Island, and Westchester, that's good for them, but that doesn't mean that you're seeing a drop in Buffalo and Rochester and Syracuse and Jamestown. We know we haven't reached our peak yet.
And remember, these are just models, they're just estimations, so we'll have to wait till we live it to see what really happens.
Aaron from the Buffalo News.
Sure, just to follow up, you said that modeling-wise, the best-case scenario, there will still be, I believe, thousands of hospitalizations beyond the capacity locally. So aside from urging people to social distance and all that stuff, what else can be done to try to alleviate that deficit of hospital beds?
Well, that's why I'm trying to get the state to approve the construction of a COVID-19 hospital at the convention center. We're looking at other alternatives too. We have other locations identified, but there's really no sense in talking about conversion of those until we can get approval for the convention center. because that would be a primary COVID-19 location of potentially up to 1,000 patients. Yeah, we're not thrilled by what we see.
But again, it's buying us time so we can hopefully work with the hospitals to build up, what capacity that they can garner. So again, the longer we can stretch this out, the better for us, just in terms of a health resourcing structure, so we can, have more time to build up our capacity. So hopefully we'll be closer to meet whatever that peak is when it happens.
And if I can, Doctor, this is why I think some of our healthcare partners, like the hospital units themselves, are talking about not only adding beds in their hospitals, but would be considered subacute facilities. Can you talk about that?
Right. So our hospital partners are working to convert some long-term care facilities to what we call subacute care facilities. So those are hospital-based facilities that are able to care for people that don't need the highest level of care, so they don't need an intensive care unit, they don't need an acute care medical or surgical bed. However, they're not quite well enough to go home. So this subacute care is a level of care that can, take the pressure off of the hospitals and expand the bed capacity for people that still need some type of supervision of their care, and it frees up more hospital beds for the more ill individuals. So again, both our Great Lakes systems and our Catholic Health System are securing long-term care facilities to expand that bed capacity. So again, the more time we have, the more we'll be able to build up that infrastructure to take care of people who require all levels of care.
Thanks. Aaron from Spectrum, are you still there?
Yes. Has the county identified any ice rinks that it might be using if the deaths do continue to rise?
Not at this point, though we do know that we will be provided by New York State refrigerator containers, very similar to what they're doing downstate. So we've identified some locations for the placement of those. Of course, they require high usage of electricity and backup power, so you can't just drop them anywhere. But at this point, we are hopeful we don't reach that phase, but we have been guaranteed from New York State a certain number of refrigerated containers, if need be, to store bodies above and beyond what is capable of being held in our medical examiner's office, hospitals, as well as funeral parlors. Steve Brown.
This question is probably more for Dr. Burstein. The State Health Commissioner, Howard Zucker, was talking about an antibody test that is being developed at Wadsworth that he hopes to distribute outside of the Wadsworth lab. I don't know what you know, Dr. Burstein, about the particulars on this. I have affinities for some tests, not others. Is this something that, if it were available, do you think it would be helpful for you? Or are there other tests that are better perhaps suited for our needs here locally?
Well, an antibody test in general is a tool that we have to fight our epidemic. So an antibody test, it would be difficult to use to acutely diagnose a person with COVID-19 at that one point in time, because it does take a while for antibodies to develop. So it could be something that we might use after the fact of after people are returning back to the workforce to see if they have, hopefully, if somebody has developed antibodies. We're hoping that will impart some level of protection for at least a limited amount of time. So those individuals that test antibody positive could hopefully go into a working situation where they might be exposed to COVID-19, because we would hope that they would have some level of natural protection. So that would really be the way that we would be able to use the antibody test, is not for acute diagnosis, because somebody has antibodies doesn't mean that they are necessarily infected. So we would use it to hopefully determine if individuals have some type of hopefully natural protection and are able to to work with COVID positive patients, or just be in the community and not have to worry about being exposed to COVID-19.
And I would just note that we have impaneled, or empowered, I should say, our logistics procurement team to try to obtain those antibody tests, in addition to just the normal tests and other PPEs that we're doing. As you can imagine, everybody's trying to get them, so we're hoping that New York State can develop its own test at Wadsworth and be able to distribute that out rather than us have to get it from private labs elsewhere.
Right, and we haven't been notified, to my knowledge, that we will be receiving these tests anytime in the near future. You know, again, they have to be approved by the FDA's, their emergency authorization scheme, and so we have to wait till they receive some type of FDA approval.
So we'll finish out this round, and then we have Kelsey Anderson from WIVB.
Hi, yeah. One more question. Do you have any update on the 2 bars that had violated the governor's pause order that Erie County shut down a little over a week ago? We're hearing that their liquor license may have been suspended. And can you confirm or deny that, and then speak to that at all?
I don't know. I know they asked, the State Liquor Authority reached out to the county for information on the cases, but I don't know the status of those cases. You'd have to confirm it with the State Liquor Authority. And then Madison Carter. Madison?
Yeah, last thing. This morning, the governor said again that his priority is on testing. And I know since the beginning of this outbreak, people here have been receiving conflicting messages. We're listening to the governor say his priority is testing, but the messaging from the county has always been that's not what we need to focus on. So as he continues to say that, and as the county continues to say we're not focused on testing, what should the residents of Erie County be thinking about how we're going to move forward through this?
Well, our problem is you can say one thing, but if you don't have the capability to deliver it, it really doesn't matter in our eyes. So there was a big problem with testing. We understand that. We have one of 3 public health labs in New York State: the Albany lab in Wadsworth, the New York City lab, and the county lab. And our county lab was one of 3 that was the only ones that were doing testing for the long time, but we were solely dependent on swab kits and reagents from New York State and the CDC. And when we ran out and they didn't give us more, there wasn't much more that could be done here. We couldn't even sample people and give it to New York State to do the testing. We have since obtained more test kits, and we have since obtained more reagents. And we're lucky now in that Kaleida Health can do tests, Catholic Health can do tests, ECMC can do tests. There's a few other private entities out there that are doing tests. That originally, when everyone was talking about how few tests were being done here, there was only one entity that had the capability of doing analysis, and that was Erie County, and we didn't have the supply to do it. So if we get more tests and we can share more, we will certainly do more. But we're at the mercy of the swabs and the reagents. So I understand the governor saying he wants a test. I agree. But if we don't have it, telling people that testing is the answer when we have no ability to test is not going to get us much of anywhere. And I know the governor's staff probably doesn't want me to say that publicly, but I got to tell the truth that if we don't have the testing capability, the best thing we can do is test the ones that we have to test because of their high priority situation, and tell the rest of everyone else, stay home, stop the spread, save lives. And with that, my voice is getting a little cracked, and I'm not sick, I just need some water. But everyone, be safe, stay home, stop the spread. We will save lives. Let's reduce those hospitalizations that we are very worried we're going to see in the next month. If we'll do that, we'll be a lot better for it as a community. Thank you, everyone. Take care.